Hi, and welcome back to the Immunity Blueprint Summit. We are so glad you are here. I'm Emily, and you know my co-host Lynn, and today we have another wonderful guest who's going to share her knowledge about immunity and our immune system. Please welcome Dr. Judy Tsafrir. Did I say that correct?
You did.
Oh, good. Dr. Judy is a board-certified adult and child psychiatrist and psychoanalyst. She is a part-time faculty member of Harvard Medical School. She has a holistic private practice of psychiatry with a particular focus on environmentally acquired illness. She's also a professional astrologer, tarot reader, and shamanic practitioner. And her practice is dedicated to healing through the integration of body, mind, heart, spirit, and biosphere. And her intention is to help patients cultivate a resilience during this time of crisis on our planet, and we definitely seem to be in crisis right now. Can you please tell us a little bit about yourself and how you became interested in holistic healing?
Yes, I practiced as a fairly conventional psychoanalyst for more than 20 years. And then a crisis in my own life precipitated me consulting an astrologer for the first time. And I became so fascinated with that I returned to see her multiple times and decided to pursue learning astrology myself to be able to look at the charts of my family and friends and patients. And that opened up something for me, and I began to explore other modalities. I studied with Natasha Campbell McBride, who's the person who was really way ahead of her time in talking about the connection between the gut and the brain and the immune system. She wrote a book called The Gut and Psychology Syndrome. And that was really the beginning of my explorations. And I went on from there to study with Dr. William Walsh in Chicago, who's a biochemist who uses nutrients to treat psychiatric disorders. Somehow that spiritual awakening that occurred for me with all of the crisis that was going on caused me to open up my vision. And I went on from there to get very interested in environmental causes of psychiatric symptoms. I had mold exposure myself, and that began an exploration of mold as a precipitant to psychiatric symptoms. And I mean, I think at the heart of it is that I came from a family where there was a lot of trauma and a lot of medical and psychiatric illness for which there was no real understanding of the cause or how to treat it effectively. And now I know so many things that would have been so helpful to the people that I loved, but unfortunately, they're no longer with us.
That is quite an impressive depth and breadth of experience and expertise. And we're glad you went down that path to be here today. So if you could explain what a holistic psychiatrist is and maybe how people find you and why someone who's concerned about their immune system and overall health goes to you. Like, are they just kind of they've seen other doctors before? Or?
Yeah, I'm usually not the first stop. But a holistic psychiatrist is someone who looks at what are the underlying causes of the reason that a person is experiencing depression or anxiety or brain fog or attentional problems. It's not like conventional psychiatry typically targets symptoms and prescribes pharmaceuticals in order to treat. And, you know, there may also be a component of some sort of talking therapy, but it doesn't. And so there is like an idea that well, if it was dynamic therapy, that their past was somehow related to what they're experiencing now in the present, which I also agree with. But there's other kinds of therapies like cognitive therapies that again targets symptoms and teaches you different sorts of coping skills. But a holistic psychiatrist tries to find out like the root cause. So I was talking about the gut health. So, you know, many patients who have psychiatric symptoms, I would say most, have some kind of dysbiosis, some kind of imbalance of the microflora in their gut, and that causes symptoms.
And probably inflammation as well.
Yeah.
Right. Well, the gut health leads to inflammation, and it leads to, you know, leaky gut and also leaky brain. And so inflammation is key. And the immune system is very much a reflection of, like this, the health of the immune system is very much a measure of the degree of inflammation in the body. So I might also see if a person had other kinds of biochemical abnormalities that might contribute to them having anxiety or depression or attentional problems, like people who have elevated copper or who have problems with methylation. And all of those things.
I'm sorry to interrupt. Can you explain to our viewers what methylation is?
Methylation is a biochemical process that takes place, I don't know, I could say millions of times or billions of times a second in the body. And it's involved in detoxification. It's involved in synthesis of neurotransmitters and all kinds of biochemical reactions. And because of either inherited genetics, or it can be the result of environmental exposure or trauma, a person's capacity to methylate can change, and they can not be good at methylating. So if you can't methylate well, then you can't detoxify. So I was talking a little bit before about mold toxicity. And so like 5 people could live in a home and only one person is ill from that home. And that's the person who cannot methylate properly. So they can't deal with the mold toxins. So it's a very crucial function. And it can be supported with nutrients, but also, for instance, in the case of something like mold toxicity, by getting the person out of the moldy environment and also getting the mycotoxins out of the body, which can be done with a whole protocol and approach to doing that, and can make a huge difference in a person's level of well-being and immune health. I mean, immune health is really at the heart of everything. And I mean, now here we are in the initial days of the COVID-19 pandemic. And I mean, social distancing is, of course, very important, but also extremely important is the health of your immune system. So, I mean, all of the interventions that I do with my patients typically are targeted towards improving their immune health. And that is also what will make a difference in terms of a person who may be exposed to a virus but doesn't get it because their immune system can deal with it.
Right.
So if somebody were to come to you as a new patient, how do you work with them? You know, kind of describe what that looks like. What kind of information do you look for? What kind of tests are you going to conduct to kind of understand what the person is needing?
Right. Well, I first have a rather extensive conversation on the telephone with them before I set up any consultation, because I want to assess the person's level of motivation before I make an initial appointment, because a holistic treatment is not for the faint-hearted. It's a lot of work. It's different than like, take this Prozac and I'll see you in 3 months. It's a very different story. And in particular, I discuss with my patients how willing, first I want to know what their diet is like on the phone. And often someone will say, I have a healthy diet. And, that can mean so many different things to different people. Like they may think their diet is healthy and I may not think so. But I want to assess level of motivation, and I am to some degree willing to meet people where they are. But if a person, for instance, is not willing to at least stop eating gluten and dairy and minimizing sugar, I don't really think there's that much point. I'm not going to be able to be that helpful. And it's sort of a indicator of how capable they will be of implementing all of the other recommendations I make, because it really involves often taking a lot of supplements and making lifestyle changes that require a lot of consistent effort. And so there's that initial phone conversation. And then I send the patient a very detailed and extensive health history form. And once if they fill out the health history form with care and thoughtfulness and thoroughness, I feel as though I have a really good idea about who I'm going to meet before I meet them. And then we have our initial consultation, which is an hour and a half long. And I'm not going through collecting information. I'm focusing on things that struck me about what they wrote in their form, or things that maybe were omitted. But it's a kind of strategic conversation based upon the information that they provided me, and we can make the best use of our time together. And then I make a lot of recommendations at that initial meeting about diet, about hygiene with personal care products and household cleaners and electromagnetic frequencies. I very often recommend at that appointment that they try a prescription medication that's called low-dose naltrexone, which is really a wonderful drug that modulates the immune system. There are some people who have autoimmune conditions where nothing else has been helpful to them besides low-dose naltrexone. And it's safe, it's inexpensive, and most people tolerate it well. Occasionally, there are people who do not. But if people are able to tolerate it, sometimes it's nothing short of miraculous. So I recommend almost everybody to try that. There are a couple of contraindications, like if a person is on opioid drugs or is taking any immune suppressant therapy, then they can't try it.
I want to go, sorry to interrupt, I want to go back to the low-dose naltrexone in a minute, but there was a lot packed in that response. And you mentioned diet and supplements. And I'm curious if you find any trends, or there are certain dietary and supplemental recommendations you make. But I'm also curious, when people come to you, are they typically on some sort of anti-anxiety or antidepressant, and you try to get them, is that part of the trying to get them off of those?
It really depends upon what a person wants. Very often a person comes to me because they're on some kind of prescription medication, very often an antidepressant or an anti-anxiety medicine like a benzodiazepine. And there is just an incredible lack of knowledge and skill in terms of getting people off of those medications. And also,
would that be like a Xanax or
right, like Xanax or Ativan or Valium or Klonopin. People are on these medicines that have been prescribed to them without really letting the person know that it may be extremely difficult for them to get off of them.
Yeah.
And I was not trained in my residency to talk with patients about, I think there's more consciousness today, but really not enough. And then they'll maybe change practitioners, and they'll see someone who says, well, let's get you off of this. And they'll take them off of it way too fast. Whoa. And the person will have horrendous withdrawal syndrome. And it's really just hellish anxiety. And weird flu-like symptoms, sweating, I have a few patients in my practice now who were taken off of things too quickly, or, in one case took herself off too quickly. And what we needed to do was to reinstate the medication and then to decrease it really very cautiously and slowly, like 10% a month. Like, it needs to be compounded so that it can be decreased really, really slowly. And if that's not done, a person very often has some really bad symptoms. And sometimes a less aware psychiatrist will say, well, you see, it's your anxiety coming back. But it's not. It's a withdrawal syndrome.
Wow.
So, that is a frequent cause of people consulting me because they want to get off of medications. But sometimes a person is just really suffering, and they know that if they see a conventional psychiatrist, that the first thing that's going to happen is that the person's going to pull out a prescription pad. And I really don't want to see patients who are calling me saying my psychiatrist retired and I need someone to renew my stimulant prescription. That's not for me. I'm glad to prescribe if the goal is to get off of the medications. And, in some rare cases, they can be used judiciously and appropriately. Many of the recommendations that I make, it takes a while for things to take effect. It's not a quick fix. So sometimes there can be like a stopgap measure, but you have to really weigh it and be careful that you're not going to prescribe something that then they're going to have trouble getting off of.
Can you talk a little bit more about naltrexone then, and what exactly is it, and how is it beneficial to your patients and to their immune system?
Sure. So it was first created in the 60s to treat addiction. So you've heard of like naltrexone, which is, it's like an opioid blocker. Mm-hmm. So it was prescribed to people who were using opioids or who were alcoholic, and it would make it so that if they used those substances that they wouldn't get high. And it's even used today to like block, like if a person has an overdose, it can be used. But in the 80s, a doctor observed, I think a doctor in New York observed that AIDS patients who were taking very low doses of it, and I don't really understand how a patient would have taken a low dose of it, but this is what I understand about how this went, that these AIDS patients, that their AIDS was much better, their immune systems were much less compromised. And eventually there was just a lot of people who used it to treat the immune system. So the doses that, like the conventional doses for treating addiction is like 50 to 100 milligrams. And that's the dose that you could get at like Walgreens or CVS. But the doses that I use are 0.5 to 4.5 milligrams. So a very low dose, and it has to come from a compounding pharmacy. And like, there are people who, have suffered with ulcerative colitis or MS, and nothing helps them, and only when they started, and they were on all kinds of conventional immune suppressant drugs, and only when they started low-dose naltrexone did their disease go into remission. Wow. And I've had experiences with it with a patient who had like a migratory myositis, like muscle pain. Like she would wake up in the middle of the night and her hands would just ache so much that she would have to massage them. Like she couldn't go back to sleep. Her hands were just aching. Within a week of starting the medicine, it just went away and she could sleep. Wow. And this is kind of funny, but I have one of my dogs is a little furry white dog, and he's 13. And for 11 years of his life, he was licking his paws all the time, like lick, 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 till they were just so brown and really not nice looking. And I decided to give him a little bit of low-dose naltrexone. I had tried everything. I had tried special diets and homeopathy and all kinds of things, and nothing helped. And within a month of him taking the low-dose naltrexone, he stopped licking and his paws were snowy white.
Wow.
It's not, you know, magic for everyone, but for certain people it really is. And because it is safe and inexpensive, it's worth trying it. And I mean, I think, you know, just the fact that it's like an immune system modulator, it's probably like a great thing now with the virus. My approach is to help the immune system. And it's had benefit for people with depression, anxiety, PTSD. I mean, it can help with just such a wide variety of conditions, and it's unpredictable who is going to benefit from it. But many, many different people with, you know, fibromyalgia, chronic fatigue. It's really very, very helpful. There's a website. It's called the, I think, low-dose naltrexone Research Institute or something like that. And there's a lot of information there, and lists of practitioners who prescribe it. There was a piece on NPR recently about somebody who was taking it for chronic pain, and that it was magical compared to anything that she had tried previously.
Wow.
That's amazing. And because aside from the chronic pain and the brain fog and all those physical symptoms, because I had fibromyalgia myself, and I went from highly functioning to out of bed 4 hours a day. And I think the worst part of all of that wasn't the head to toe pain. It wasn't the brain fog. It wasn't the rashes. It wasn't the sleepless night. I mean, it was everyone telling me it's all in your head, and
Right.
isolation and invalidation and dismissing that emotional piece was really tough. So is there, like, what's the kind of success rate that you've seen with your patients anyway? And I know everyone's different, but.
Well, I mean, I had a success rate before I was a holistic psychiatrist. I mean, just being a psychoanalyst and talking to my patients, I mean, I seem to, patients benefit from working with me, it seems like.
And then just from the low dose, the LDN.
Oh, but the low dose naltrexone? Let's see. It's hard to isolate it, you know, because I do so many different interventions at one time. I don't know. I would say that it's really hard to say. You know, like maybe 60% of patients really see like a radical difference, but I'm not sure about that.
Well, are there any other medications or supplements that you prescribe for your patients that are
I
beneficial?
prescribe so many, you know, like depending upon what the issue is. Like I trained with Dr. William Walsh, as I mentioned, and he has specific protocols for copper toxicity or undermethylation, and it involves B vitamins and A and D. I mean, everybody gets 10,000 units of vitamin D in my practice. I mean, high dose vitamin C is also great for the immune system.
Really good. What about IVMT? I did a little bit of that for my intravenous micronutrient therapy, IVMT, where you sit up with and it's loaded with C's and B's.
Yeah, I've heard that's like super helpful. I mean, I'm not set up, and my practice is on the third floor of my home, and I don't have capacity for anything like that. I'm a one-person practice. But I think that is, you know, something that can be super helpful for people.
Mm-hmm.
Did you had it, and was it helpful to you?
It was helpful as a complementary approach.
Yeah.
But it was kind of it boosted the immune system, and
Right.
it gave me that extra punch that I needed to get going. And there were a couple different. There's a variety of concoctions or different formulas.
Right.
But I mean, for me, all I needed was maybe I had one every 3 months, and then 6 months later, and then I was just doing management. For me, it really helped quite a bit.
Yeah.
And it's individual; it's all bio-individual.
Mm-hmm.
But you were talking about mold toxicity and your interest in environmentally acquired illness. There's something that you talk about too, mast cell activation syndrome. Can you explain a little bit what that is? That's really interesting.
So, like mold toxicity is the cause. You know, like a person will have mold toxins in their body because they've been exposed either acutely or in the past and their body has been colonized by mold. One of the ways that mold toxicity causes problems is through mast cell activation. And mast cells are white cells in the body that that are part of the immune system. And so we have them all over our body, but the highest concentration of them is found in the parts of the body that interface with the environment. So like our sinuses, our lungs, our gut, you know, those things that touch the outside, because the mast cells are there to deal with any kind of pathogen or invader. And when they're functioning appropriately, they're, you know, vital to protecting us. But if they get triggered inappropriately, and there's just like too much of them being triggered, they have like these little granules in them that contain histamine and other biogenic active amines, and they release their granules. And that's when a person has like lots of symptoms like asthma or brain fog or different kinds of pains in their bodies or in their body. It can cause just GI symptoms. I mean, you know, these people who they eat something and then immediately they have some kind of crazy reaction. That's triggered by mast cell activation. And the treatment for it is to stabilize the mast cells, and that can be done with antihistamines as well as other supplements that stabilize mast cells. There's also prescription drugs that stabilize mast cells, but that can really provide a lot of symptom relief for patients. And it's often also really associated with anxiety, the mast cell activation. One of the approaches that I recommend to just about everybody in my practice, just like I recommend a low-dose naltrexone, is something that's called dynamic neural retraining system. And it's a program for rewiring the limbic system of the brain. It was created by a woman named Annie Hopper, who had multiple chemical sensitivity. She was so sensitive that she eventually became homeless. She just couldn't tolerate any environment whatsoever. And she developed this program which its target is the limbic system of the brain, which is a deep structure in the brain that's involved with the fight or flight system in the body. And when a person is in a traumatized state, their sympathetic nervous system is very excited and overactive, and their parasympathetic, that is mediated by the vagus nerve, is not functioning as well. So there's a big sympathetic dominance. And the reason that I started talking about this at this point is because there is a relationship between the limbic system in the brain and mast cell. Like if a person is upset or stressed, it can trigger the mast cells to degranulate. So it's very much like a mind-body kind of thing. And her program involves guided meditations and visualizations and affirmations, and it's very effective. Some people, it doesn't resonate with them, and it requires quite a bit of effort. Again, like the first, I think, 4 days, a person needs to devote 4 or 5 hours to watching her videos, which have to do with neuroanatomy and the limbic system, and there's kind of psychoeducational. And then after that, it's an hour a day commitment to doing the exercises that she prescribes. And it really works. And that's another way that people without pharmaceuticals can really calm down their nervous system and, you know, enhance their immune function.
Yeah.
I mean, the
It's all connected.
psychiatric symptoms are intimately related with immune function. And that's why like 90% of my interventions target the immune system.
Can you go a little deeper on this, the neurodynamic? Does she incorporate like NLP and like?
I think that's all sort of woven into it. You know, I'm not that knowledgeable about that, but she draws from a lot of different kinds of therapies and approaches, and she has like it's highly effective. She has like a boot camp where a person could actually go and learn the technique for like 5 days, but there's also the possibility of buying DVDs or streaming the videos that she has. There's another person named Gupta, Ashok Gupta, and he has a program that is similar to hers. And some people resonate more with his kind of vibe than hers. But they're both really good and sort of do the same thing in terms of calming down the limbic system of the brain.
Yeah.
There's also an exercise that like a YouTube video of an eye exercise by someone named Stanley Rosenberg, where it helps to bring the vagus nerve online, and it involves like looking to the side and holding until you feel like there's some kind of shift, and then looking to the other side. And again, like the vagus nerve is very much connected with that limbic system and the parasympathetic, and it's extremely helpful. So I like to like really approach it from a lot of different angles, and also like a spiritual, having discussions with my patients about their spiritual practice. And like some people would like to have a spiritual practice, but they have no idea about how to implement one, and what do you do? And so we can have conversations like that if there's an interest.
Yeah, and spirituality means different things to different people too, I think. So sorry, Emily, go ahead.
That's okay. So can you explain how, a spiritual practice does actually boost the immune system? I know that there's research on meditation and how that,
well, that's a spiritual practice, or yoga.
Right,
is a
yeah.
spiritual practice. I think it's any kind of practice that helps you feel larger than your isolated self, that helps you feel connected to other people and to the planet and to the universe. And there's different things that you can do that help you cultivate that feeling. And when people don't have that feeling, they can feel frightened and isolated and alone. And fear is really hard on the immune system.
Yeah.
I mean, because we're talking about ways really to decrease your stress and your oxidative stress. I mean, because the stress is creating more inflammation, and that's creating more problems with the immune system, right?
Right.
And I did, after my injury back in 2014, and I used a lot of it. Spiritual practice was huge, and just keeping my central nervous system as calm as possible, and meditation was enormously helpful. We're gonna have someone else talk about this, but can you talk a little bit about what you found with EMFs? And
oh yeah, that's so important. That is so important. So last September, well, let me rewind a little bit even further. In 2015, I read a book by a man named Dr. Martin Paul. That was his name. Anyhow, the book is called Overpowered, and it's all about the effects of electromagnetic frequencies on our bodies. And, like before 200 years ago, the only electricity that we were exposed to was like from lightning or from like the electromagnetic field of the earth.
Yeah.
And now the whole planet is covered with a grid of wires, and they are throwing out electromagnetic fields. And it's not only like just electricity in general, but now we have Wi-Fi, which is literally sending radio frequencies into the environment, and it's impacting our body. And we are electrochemical beings. And there are degrees of sensitivity, like not everybody is as sensitive as everybody else. There are people who are electro hypersensitive that literally have panic attacks and palpitations and headaches, and their immune system really crashes when they're exposed to these kinds of frequencies. And it's just regular wireless stuff. Anyhow, I went to a conference. It was the first conference of its kind in this country in last September. And it was held at this beautiful retreat center in California, Multiversity, 13 something Multiversity, I forget the name of it. But because there were many people there who were electro hypersensitive, we weren't permitted to we had to put our devices, like our phones, on airplane mode and to download everything onto our computers, so we weren't connected to Wi-Fi in the conference room. And there were people in there that, like, I know somebody has their cell phone on, I can feel it. Like they literally could feel the frequencies. And
wow,
the woman I met it sounds insane, but it's real. She had like some kind of special fabric that she had wrapped around her head and some special clothing that she wore to be able to tolerate the plane flight to get there.
Wow.
But anyhow, it really ignited me and inspired me and reminded me about how important this whole issue is. And I was aware of it before, and I would talk with my patients about putting their phone on airplane mode when they carried it on their person. Like there's like a principle, like the closer it is to your body, the more it disrupts you. So like for sure, you shouldn't put your phone by your ear. You should put it on the table and speak with the speakerphone, and don't put your laptop on your lap. There's a whole, the fertility rate is dropping incredibly, and men's sperm counts are way down, and the motility is way decreased. And there's all these men carrying their cell phones in their front pockets, radiating their gonads, it causes inflammation in the body, and inflammation impairs the immune system. And, in Wuhan, which was the epicenter of the outbreak, they were very proud that they had this big rollout of 5G, which is an even more intensely powerful signal. And it affects people's immunity. And
that was right before the outbreak, wasn't it?
Yeah. And I came back from that conference, and one of your other guests that is going to be, she was one of the organizers of that conference, Cecilia Doucette, and she lives in my area in Massachusetts. And so shortly after I got back, I got a notification from my city, which is Newton, Massachusetts, that they were seeking applications for grants to educate the public about the arts or science. So Cece and I, she helped me. I applied for a grant from the Newton Cultural Council, and we got a grant. We won it to educate the public about safer uses of technology. Now I think our event will be canceled or postponed because of the virus, but there is a lot that you can do to use technology more safely, like just the things that I was talking about. I mean, it's possible to use your laptop and desktop with an Ethernet cable rather than with wireless. And for sure, you should turn off your router at night, because what's most important is that while you're sleeping, you're producing melatonin And that's a time when the immune system is restoring itself, and the wireless frequencies really disrupt that. I myself, like one of my children, my youngest, is home from college now, and he goes to bed after me. And I said, please turn off the wireless in the house before you go to bed. And when he forgets, then I wake up with a headache. It's very related to headaches. So
are there any, so say we're walking around here with some level of radiation in our bodies. Are there supplements that can help us like flush that out? Like, I don't know, making this up, niacin or charcoal or what?
No. The way that you reduce
just by putting it on
is by reducing the exposure.
Okay.
I mean,
so
you can definitely support your immune system in all the ways that we've been talking about, which makes a big, big difference. Yeah. But the key is reducing your exposure. And that's also like a big conversation I have with my patients about this.
Wow. And that's real easy. Something easy we all can do is airplane mode. Every single
Totally.
So
and just, remember to check your phone every hour for text or whatever. But, it's not necessary that we have to be every single moment like instantly available, unless, there's some emergency going on.
Wow.
I want to go back to something you had said earlier, and that was that you really won't work with anyone who is not willing to stop eating gluten and dairy and to really limit their sugar. I do believe food is medicine, and I believe that what we eat determines a lot of our health. So can you talk a little bit more about why it is, maybe no gluten, no dairy, or what other food you recommend that they eat or don't eat?
Yeah, sure. That is a huge part of my practice, is the nutritional piece. And depending upon a person's motivation and kind of where they are, like some people, if they come in, and this is sort of the rare patient, because many patients who come to see me have already tried like a million things. So they're pretty sophisticated. But rarely somebody will appear who is eating a standard American diet. And then you have to they have to stop the gluten, dairy, and sugar, but you can't like throw them into the deep end. It's going to be too difficult. You need to help them do it in a doable way for themselves. But there's two approaches that I take. One, like if a person has like really obvious an autoimmune condition, like they have, Hashimoto's, or they have ulcerative colitis, or they have a lot of joint pain or eczema, they're obviously having like a lot of autoimmune stuff going on, then I recommend to them the Paleo Autoimmune Protocol. Mm-hmm. And there is a fantastic website that I recommend to all my patients that's called Phoenix Helix. And there's a podcast by the same name that is one of my favorite podcasts. And I ask that my patients listen to the first 4 episodes of that podcast, because it helps them get an idea about how do you implement a healing diet, and tells healing stories that are very inspiring. There must be 200 interviews, and they're wonderful. The host is Eileen Laird, and she's won awards for the podcast, and she really gets great guests, and she's a wonderful interviewer, and you can just learn a lot. And she gets credible people. You can learn a lot listening to that podcast. But she's also written a little book that's called A Simple Guide to the Paleo Autoimmune Protocol. And it's really like a tiny little book, a thin little book that has all the basics. And essentially, it's how do you implement an elimination diet? And there are certain foods that are top allergens, and gluten and dairy are way at the top, but so is like corn. But since it's paleo, it anyhow eliminates all grains, but corn is a top allergen, soy is a top allergen, eggs are a top allergen, nuts and seeds, nightshade, vegetables and seeds, those are the potatoes, tomatoes, peppers, all of those, eggplants. But, I don't think that gluten or dairy is really healthy for anyone, but there are certain foods that, and soy is probably also not healthy, But there are certain foods that are the top allergens that are really healthful foods and would be good to include if you're not one of those people who reacts to them. And something like eggs, I mean, that's a wonderful food if you don't have an intolerance to it. And these food sensitivities are not like eternal or monolithic. And so it may be that when you start out that you can't tolerate eggs, and that you have insomnia or anxiety in relationship to them. But then after you've done some gut healing and your immune system is repaired to some degree, then you can have eggs again. So you eliminate all of those top allergens, and then you try to identify like target symptoms. So like in my practice, it might be anxiety, it might be depression, it might be, some kind of skin condition, it might be joint pain, it might be digestive stuff. And so you implement avoiding those foods for a month or 2 months, and then you systematically and very carefully reintroduce them one at a time. And so you have like eggs, like a few bites of eggs at one meal, and again at a second meal in the day, and then you observe. And you observe for up to like a week, because the response to these foods can be subtle and profound. I had one patient who had a corn sensitivity. And when she would have corn, she would get into this just obsessive negative rumination and kind of paranoid, like thinking about, like what her friends felt about her, and was she being left out? And she had insight that this was like, why is she thinking this way? But this is what she would be obsessed with. When she didn't have corn, she did not have those kinds of thoughts. And then she went with her fiance to Mexico, and there was like chips and salsa, and she had corn, and they almost had to come home from vacation because it all just started up again, and she became so distressed. It's just profound and powerful. And for people who don't make that link between food and mood and thought, they have a hard time believing the impact of it for people who have a sensitivity. If a person, is not as symptomatic with kinds of obvious autoimmune kinds of stuff, I recommend the Walls protocol, which is also really excellent. I mean, both of the protocols are like whole foods, meaning not processed packaged foods, like avoiding preservatives and dyes and all of that. But the Walls protocol is more liberal in terms of it doesn't exclude nightshades to begin with. It doesn't exclude nuts and seeds to begin with. It does exclude eggs to begin with. But she has a food pyramid, and the bottom of the pyramid is 9 cups of vegetables. And the vegetables are of 3 groups. The first group is the greens, so that's like kale and spinach and lettuce and all of those. And you think 3 cups, that sounds like a lot, but like 3 cups cooks down to like nothing. Yeah. And then there's 3 cups of the sulfur-containing vegetables, which are like the cruciferous vegetables like cauliflower, broccoli, Brussels sprouts, but also onions and garlic. And then 3 cups of brightly colored fruits and vegetables, which are like blueberries or carrots. They're colored all the way through. Like an apple is not brightly colored. It's red on the outside and white on the inside. So it's very heavy on the 9 cups of fruits and vegetables. And then it allows those other things that are not included in the paleo autoimmune protocol. So that can be a good thing for people to start with. It's somewhat less restrictive. And even though she does not allow eggs, I recommend that after they've avoided them for like a month or 2, that they try to reintroduce them, because they're a really good food, and you want to have optimally the least restrictive diet possible. And I also have lots of conversations with my patients about learning to cook. That is a lost art for many people, and it's so essential in order to heal yourself, to cook and to know what's in your food and to make good food. On the Phoenix Helix website, they have a recipe roundtable that has a fantastic collection of recipes. And every week there's because there's a lot of paleo autoimmune bloggers out there, and there's always new recipes featured, and they're wonderful and creative, and there's no need to not eat well, but you have to like change your mindset.
Yeah, I didn't do, when I had the fibromyalgia, it wasn't the walls, it was the more restrictive. And it definitely changed my mindset entirely because I had to adapt. And I remember people thinking, oh, there's nothing you can eat, but there's so much you can eat, and it's all the good stuff. But for people who eat the standard American diet, when they see what 9 cups of vegetables really is, that's an eye opener, I'm sure, for a lot of people.
Right.
You realize you really are lacking a lot of nutrient dense food in your diet.
Right. If you think about, like a lot of times I have conversations with my patients about like our Paleolithic ancestors, like they were hunter-gatherers, and they like walked through the land, and they, collected this plant and that plant, and apparently they would have in their diet like 200 different kinds of plants, each with their own unique phytonutrient profile. And we eat like broccoli, asparagus, just like very, very non-diverse, very kind of monochromatic in a certain way.
Now our soil's non-diverse too now these days.
Absolutely.
That's a whole hour-long discussion.
Absolutely.
Wow.
So, just so many things are like that. Unless you make a conscious effort, you're not going to move at all. There's no need to move. You can just like get in the car and go to the grocery store, and you don't have to hunt or gather or just use your washing machine. And
well, you do these days if you're looking for toilet paper. It's kind of because in this new era.
There's so many things that we need to be conscious about, like in order to cultivate our health because of our modern lifestyle, which is, it really, I think part of the context of the whole virus is that people's immune systems are not robust. So many people have diabetes, so many people have heart disease, so many people have all kinds of asthma and things that make them particularly vulnerable.
Autoimmune and autoimmune. We've seen the figures out there from ARDA, but my guess is that the numbers are far higher than we realize, and they're I don't know, maybe that's part of all that.
Right, and for the conventional treatment for autoimmune disease is immune suppressant drugs, which then makes you more vulnerable to infection.
Well, when your patients have gone through your program, or they're feeling better, do they feel like they have to work as hard as when they first started? Does it get easier for them? You talk about, it's a lot of work, but in the long run, is it as much work?
No, you can be cured of mold toxicity. I think everybody, because of the toxicity of our environment, should be taking binders. People should be sort of routinely taking charcoal or clay or different kinds of fibers to mop up just toxins in the environment. But no, the kinds of conditions that Dr. Walsh describes and prescribes protocols for, that is more like conventional psychopharmacology in terms of you need to keep taking those supplements. You don't get cured from it, and the supplements help. The diet stuff, like you may have to be more restrictive in the beginning, but then as your gut heals, you can have a wider variety of foods. But you can't go back to eating garbage, you can't. Right. And you can't exercise, you can't. In some ways, I don't think it really becomes less work, but it becomes less burdensome because you're just used to taking care of yourself that way.
And I'll tell you, you know, in my experience, I didn't want to go back. It's, you know, there was no way. And I will get, you mentioned earlier, like certain symptoms that might come back. Like mine for me was either I would feel that head to toe pain, and then I knew, I've been incorporating this food back in. I need to get it out. That was
Right.
the digestive stuff and the rashes. Those are my 3 go-tos.
Well, that's so great when you can identify that and know exactly, you know, like, I mean, that's really helpful. And also, you know, like a person like, oh, they just love cheese so much, and oh, they're just going to have some cheese, and you know, then they end up feeling like really depressed. And once they make that link, they're like, I mean, and very often people have to, I mean, people had so much trouble like around the holidays, you know, like everybody relaxed their, I don't know, their standards, and were eating stuff that they wouldn't normally eat. And people felt like crap, and so relieved when January came and they just stopped doing that.
Why bother? Why do that in the first place? Yeah.
Right. But it's so common, and you know, and we're not perfect. But it is really, it's really great when you can see the direct link, and it's very reinforcing in terms of doing stuff that makes you feel good.
Well, you know, I've had clients just don't tell me not to eat cheese because it's not going to happen. And
Well, that's the one, that's the cheese is the biggest one, right? It's like the one that's like, don't take away my cheese, you know, like that's the people. And there is something like cheese and wheat, like there's receptors in the brain, glucomorphines and casomorphines. They're literally like opioid receptors.
Yeah.
And people are addicted.
Yeah.
It's so comforting. They have such craving for it.
Well, this is really fascinating, really important work that you do. And I've absolutely loved this discussion. I could probably go on for another 2 hours, but we don't have 2 hours more. So, Dr. Tsafrir, I have trouble with that all the time. Tsafrir, please tell our viewers where they can find you. If they want to reach out to you, where can they find you?
So I have a website, that's my name, judytsafrirmd.com. And I also have a blog, and I write about these kinds of things that I'm talking about. And be very glad for people to sign up for my blog. And my website has a lot of information on it. All of the things that we've been talking about, I've written about on my website. So I invite everyone to explore it.
Right.
Awesome. Well, thank you so much for being with us and taking your time to share some of your wisdom on what you do to help your patients with their immune system. And I think it's important to note that it's just all integrated. You know, we can't separate, you can't even separate our thoughts from our health. Yeah.
Absolutely. I totally agree. And I really appreciate what you guys are doing, and a summit that's dedicated towards the immune system, because that's really the key to health.
Sure is. Thank you very much.
Thanks for having me.